Hello friends, this is Kavita homeopath from USA. Welcome to Ka Homeopathy Study Group Pro Bono webinar. Good morning, good afternoon and good evening. So nice to see many of you from different countries and different time zones. Before we start our webinar, we always thank Universe for giving us this great opportunity. Dr. Sweta Singh, our Ka Chief Administrator, will start the session.
Thank you so much, ma'am. Shall I start the intro video, ma'am? Thank you, Dr. Kavita, and it is my privilege to introduce Ka Homeopathy Study Group with the viewers. And the Ka Homeopathy Study Group Pro Bono was organized and founded by homeopath and humanitarian Kavita Kukunur, President and CEO of Kavita Holistic Approach, Ka. This study group is intended to be an offering from Dr. Kavita to the homeopaths around the globe, sharing goodwill and solid clinical work within the classical model are foundational principles for the Ka. Ka's mission and vision are very unique to inspire young homeopaths, mentor, provide excellency for educational purposes using holistic approaches via webinars, which are based on principles of classical homeopathy, and provide professional continuing educational homeopathy credits for practitioners. We provide merit certificates for spreading the light of homeopathy around the globe. Dr. Kavita is a member of Kevin Friendly Foundation, a non-profit organization that helps to serve poor people in greater needs in India. She is also the associate editor of the Homeopathic Heritage and member of CHC PR Committee and a China CPD provider. She is the recipient of Martha Ullman Community Service Award by National Center for Homeopathy and Best Entrepreneur Award from Dr. N. Linga Raju, Principal of JSPS Homeopathic Medical College, Hyderabad, India. Also, Dr. Kavita received the prestigious Legendary Homeopath Award with joint hands of Honorary Health Minister Dr. Dhan Singh Rawat, Senior MLA, Mr. Harbhajan Singh Chima, Ex-Director Homeopathy, Government of Uttarakhand, and Chairman of HomeoCure and Research Institute during National Homeopathic Seminar, Homeopathy, the Future Medicine at Kashipur on August 21, 2022. Dr. Deepak Sharma, Ka mentor, Dr. Rajenesh Sharma, Ka advisor, and myself, the Ka team were also recognized and presented with Legendary Homeopath Award at the ceremony. We are extremely happy and proud that we celebrated 11 years of her book Beyond the Limits, a challenge to prove oneself. And at the Ka's second annual celebration, our honorable guest of speaker, Dr. Jawahar Shah, Chairman of Enlightenment Education, launched audiobook and hard copy of her second write-up, A Dose of Spirituality with Kavita. Dr. Kavita donated the proceedings of the book through Ka Study Group platform to various charitable organizations and homeopathic association. To name a few are Kevin Friendly Foundation, CHC, DHMA, JSPS College, VT Seva, NCH, etc. We will share the recording link in the Zoom chat box and interested one can have the glimpse of the book. Purchase link will also be shared. As of now, we have over 250 plus recordings on professional webinar related to homeopathy, health related topics and inspirational talks available on our channel, Kavita Kukunur. This webinar is moderated by myself and it is being recorded as we speak, and we will take questions at the end of the webinar. We will post a jot form in Zoom webinar chat at the end of the webinar. So please fill the form to receive your certificate. You will get it in within 1 week. If you're Kindly mute yourself and turn your video off for better connections. Thank you so much. Over to you, Dr. Kavita.
Thank you so much, Dr. Sweta. She manages all our activities with cute smile. And Dr. Sweta is Dr. Sweta Verma there, or she would like to come at the end?
Yes, she is there. Dr. Shweta, please unmute yourself. Please allow her to unmute, ma'am.
Yes, I am doing.
It's done now. Hello, everyone. Should I start reading the codes of ethics?
Yes, please.
Definitely. Dr. Sweta Verma.
Yeah. So, these are the ethics and benefits of Ka Homeopathy Study Group. First, to be a Ka speaker needs at least 1 to 2 months active volunteering. Second, only Ka speakers' theme are promoted in newsletters and webinars. Third, Ka provides volunteering for 2 to 12 months, respects and inspires volunteers to grow. Fourth, active volunteers will be promoted through our website, social media, and added to WhatsApp group. Fifth, articles of volunteers will be posted on Ka website and newsletter and will be sent for publication at other journals too. Sixth, active volunteers are eligible for prestigious Ka annual awards. Seventh, volunteers are eligible for Ka inspirational talks. Eighth, volunteers are eligible for case discussions. Ninth, Ka promotes homeopathic organizations as well as their mega events. 10th, Ka promotes great work of speakers through their book reviews. 11th, honorable guests may propose their future courses or events after the webinar. 12. Ka maintains a healthy and happy environment, so keeps only like-minded folks. 13th, Ka requests everyone to maintain the confidentiality of the group. Thank you so much.
Thank you so much, Dr. Sweta Verma. She is our enthusiastic volunteer. I thank Ka Homeopathy Study Group entire team for their continuous selfless support with which we are able to make our pro bono activities and webinars so beautiful. These webinars are for educational purposes only and should not misuse any of the course content without speaker's permission. Always seek an expert homeopath for treatment. Being an outreach coordinator of CHC PR committee, HNA CPD provider encourages homeopaths to become CHC certified and to participate at HNA accredited webinars. Today, October 16, 2022, we have two honorable speakers, Dr. Kavita Chandak and Dr. Rajenesh Kumar Sharma, with a very interesting and important topic, victory of homeopathy in cerebral atrophy, spine degeneration and internet hazard. Many clients reach us for a wide variety of neurological and degenerative conditions, and homeopathy does miracles. When applied based on homeopathic principles, it brings surprisingly positive results. Today's session will be 1 hour 45 minutes and might extend little more if speakers agrees to. And our first speaker, Dr. Rajenesh Kumar Sharma from Kashipur, Uttaranchal, India, MBBS, MD Homeopathy. He is world-renowned homeopath, Chief Managing Director of HomeoCure and Research Institute, Sparsh Multi-Specialty Hospital, and Vaibhav Homeopathic Pharma, Kashipur. Doctor of Literature from UK, Doctorate of Homeopathic Medicine from UK, Postgraduate Diploma in Homeopathy, and Doctor of Medicine Homeopathy, Bachelor of Science, First Division, Humayun University, Nainital. He is a recipient of Lifetime Achievement Award 2022, Excellence in Homeopathy Award 2022, Gold Patron of Hahnemann, Haus Turku, Germany 2016, Homeopathic Gem Award 2011, International Gold Star Award 2010 from Thailand, Bharatiya Chikitsak Ratna Award, Mother India Udyog Ratna Award, honored by Bharati Now Chetana Manch for Research in Cancer 2006 Excellence Award. There are so many Best International Feature Award and Best of Social Services in Field of Medicine, Homeocure Research Institute ISO certified. He is External Examiner, Faculty of Homeopathy, Dr. B.R. Ambedkar, Agra University. Life member of Akhil Bharatiya Brahmin Mahasabha, life member of Indian Institute of Homeopathic Physicians, Now Chetna Smartak Manch Kashipur, member of Asta Trust member. There are so many. Congress State Vice President, Rashtriya Dalit Manvi Dadgar, BM Samit Delhi, Homeopathic Medical Association Editor, Homeosin Contributor Editor, Hahnemannian Sandesh, DHMA, International Associate Editor, and many more. There is so much to say about Dr. Rajenesh Kumar Sharma. And for more details, visit www.cureme.org.in. Dr. Rajenesh Kumar Sharma is our Ka advisor, recipient of Ka Hahnemann Award 2022, and part of our Ka family as our dear brother who is always helpful. And our second speaker, Dr. Kavita Chandak. No introduction is needed for her. A homeopath, MD Homeopathy, PG NIH, PG Homeopathy, and from London, PhD from France. Dr. Kavita Chandak from Nagpur, Maharashtra, India, is a gold medalist scholar in homeopathy. She is an author, speaker, trainer, teacher, and promoter of homeopathy. She is attached with PhD, PD Jain Homeopathic Medical College as a guide for PG students for the subject repertory. She is an international faculty invited by 20 plus countries to deliver seminars on homeopathic contribution in psychiatric disorders, autism, women disorders, and cancer. Honored by holding 2 Golden Book World Records for treating kidney disorder and case mucormycosis. She is an advisory board member of Turkish Clinical Journal of Istanbul. She is a scientific committee member at Deuce University, Turkey, and at LMHI 2022. She is a board member of Afghanistan Homeopathic Association. She is running an NGO, Padmaja Welfare Foundation. She is dedicated to the field of health and rehabilitation. She is an excellent speaker and a social activist, received many national and international awards for her generous socio-medical contributions towards society. She is recipient of Excellence in Homeopathy Award 2022, given by hpathy.com to 66 renowned homeopaths throughout the world, and Dr. Rajenesh Kumar Sharma was also there. She has won the INSC Research Award for her paper on autism, has authored many medical books on gynecology and psychiatry. She has organized 800 free medicine distribution camps till now. To spread awareness, she writes health articles, delivers sessions on TV, radio. She is providing her services through her web clinic in 20 plus countries. Her specialty area is behavior psychiatric disorders like autism and ADHD. She has 2 Golden Book of World Records under her name for treating kidney disorders and mucormycosis. There is so much to tell about her, and for more information, visit her website www.drkavitachandak.com On top of all this, by nature, she is very kind and loving, who came all the way from Nagpur to Delhi just to see me when I went to India at HPWWC conference in 2020. And without further delay, let us honor our first speaker, Dr. Rajenesh Kumar Sharma, to our webinar.
Thank you. Thank you, PHA, for giving me this opportunity to share my views on this topic. Let me share my screen. Is it visible to you?
Yes, sir.
Hello, I am audible?
Yes, sir. Yes, sir.
Okay. Thank you. The topic is victory of homeopathy. Homeopathy is always victorious in every respect, especially in cerebral atrophy, spinal degeneration, and internet hazard. We will discuss certain points here. An introduction to neurodegenerative disorders. What is cerebral atrophy? What is spine degeneration? What is internet hazard? What is effect of internet hazard on neurons? What is homeopathy in short? And victory of homeopathy on neurodegenerative disorders. Degenerative diseases of central nervous system are disorders characterized by cellular degeneration of subsets of neurons that typically are related by function rather than by physical location in the brain. They cause symptoms that depend on the pattern of involvement in the brain. There are certain effects of various lesions in the brain according to the location of the lesions. Cerebral cortical neurons, they cause loss of memory, loss of language, insight, and planning, all components of dementia. Neurons of the basal ganglion, whenever damaged, they cause deficit in movement disorder. Those of cerebellum cause ataxia. Those that affect motor neuron, they result in weakness. Although many degenerative diseases have primary targets, other brain regions are often affected later in course of their illness. There are certain brain disorders which are associated with particular type of protein deposition or depletion inside the brain. I'm not going into a mega pathology of the regions, but certain names are to be included here. Parkinson disease, multiple system atrophy, hereditary cerebral amyloid angiopathy, Congophilic amyloid angiopathy, Alzheimer's disease, frontoparietal dementia, familial British dementia, transmissible spongiform encephalopathies, amyotrophic lateral sclerosis, Huntington disease, inherited spinocerebellar ataxias. Our knowledge about neurodegeneration is very deficient. While arguments can be made regarding pathological processes that make neurons vulnerable to degeneration, we still do not know fully why some people are physiologically more susceptible to specific neurodegenerative disorders and why some different persons are not. Different neurodegenerative diseases cluster within some kindreds. It is clear that the common neurodegenerative conditions share similar processes. The pathophysiology among all the neurodegenerative disorders is almost similar. Role of neuropsychology in neurodegeneration. A neuropsychological assessment, NPA, can serve as a valuable tool in the investigation of patients with known or suspected neurodegenerative disorders. Common reasons for referral include memory complaints, expressive language difficulties, poor visuospatial awareness, poor decision making, disorganization, reduced attention, concentration difficulty, changes in personality and behavior, and deterioration in functioning such as difficulty coping at work or managing one's finances. Summary of neuropsychological profiles of common neurodegenerative disorders given here. Actually, this is a broad area of neurodegeneration. We will come to cerebral atrophy and spasticity later. Alzheimer's disease, I have told all narrated all the names already. Let us come to the point. Our topic is cerebral atrophy. That was just an introduction. Atrophy of any tissue means loss of cells. Whenever there is a loss of cell, number of cells are decreased in, whenever cells are decreased in number, this is called as atrophy. In brain tissue, atrophy describes a loss of neurons and the connections between them. There is loss of neurons in number and as well as connections between them. Atrophy can be generalized, which means that all the brain has shrunk, or it can be focal, affecting only a limited area of the brain, resulting in a decrease of the function of that particular area of the brain. If the cerebral hemispheres are affected, conscious thought and voluntary process may also be impaired. Cerebral atrophy is frequently associated with a condition known as hydrocephalus ex vacuo. It has its sign and symptoms. As cerebral atrophy is simply the compensatory enlargement of the CSF spaces from reducing the brain parenchyma volume. It is akin to hydrocephalus ex vacuo. Cerebral atrophy has certain pathology. The underlying pathological causes can broadly be distinguished based on whether the atrophy is focal or generalized. In case of generalized atrophy, it may be age-related due to cardiovascular disease and stage multiple sclerosis. Alcohol abuse, which is also called as cerebellar Burman atrophy, drug abuse, post-traumatic, that may be due to injury to the axons, post-infective, like in encephalitis or meningitis, and certain neurodegenerative diseases like progressive supranuclear palsy. In case of focal atrophy, the pathology may be due to post-ischemic injury, post-traumatic, like hemorrhages, contusions, concussions, certain neurodegenerative diseases like Alzheimer's dementia, Parkinson's disease, frontotemporal dementia, fixed disease, Huntington disease, and corticobasal degeneration. There are certain patterns of cerebral atrophy. Certain important patterns of cerebral atrophy that are more specific may include severe frontal anterior temporal lesions that are seen in fixed disease, head of caudate nuclei, as in Huntington disease, posterior partial or frontal lesions, as in corticobasal degeneration, atrophy of tectum, globus pallidus, and frontal lobes, as seen in progressive supranuclear palsy, generalized with atrophy of substantia nigra, as in Parkinson's disease, and severe hippocampal atrophy that is seen in Alzheimer's dementia. Let us see a glance to fixed disease. Progressive degeneration of neurons is there. Intracytoplasmic fixed bodies here. Cortical atrophy is there. And knife-edge gyri, the sharp bases of gyri, they are seen there. Symptoms may include dissociation from family, extreme oniomania, vulgar speech characteristics, screaming, inability to control mood, emotions, behavior, personality, and temperament. These are characteristics. Corticobasal degeneration. This is another point. It has asymmetric Parkinsonism. There are some movement disorders like dystonia. What is dystonia? A movement disorder that causes the muscle to contract abnormally. Another one is stimulus sensitive myoclonus, action postural tremor. Another symptom is higher cortical dysfunction, which includes dementia, aphasia, apraxia. What is apraxia? Loss of the ability to execute or carry out skilled movements and gestures despite having the desire to perform them. Cortical sensory loss, which is isolated loss of discriminated sensation of hysterogonosis, graphesthesia, position sense involving one or two parts of the body. Another one is alien limb syndrome. What is alien limb syndrome? It is a phenomenon in which one hand is not under control of the mind. Now, we must come to the causes of cerebral atrophy. Some diseases are to be mentioned here, which may cause the cerebral atrophy. I have already pointed out some of them. Stroke and traumatic brain injury, Alzheimer's disease, fixed disease, and frontotemporal dementia. Cerebral palsy, in which lesions may impair motor coordination. Huntington disease and other hereditary diseases associated with genetic mutations. Leukodystrophy, like rabies disease, which destroys the myelin sheath of the brain. Mitochondrial encephalopathy, such as Kearns-Sayre syndrome, which interferes with the basic function of the neurons. Multiple sclerosis, which causes inflammation, myelin damage, and diseases in the cerebral tissue. Infectious diseases like encephalitis, neurosyphilis, AIDS, in which infectious agents or the inflammatory reaction destroys the neurons and axons. Symptoms. Cerebral atrophy has its own symptoms. Many diseases that cause cerebral atrophy are associated with dementia, seizures, and a group of language disorders called aphasia. There are three points to discuss here: dementia, seizures, and aphasias. Dementia is characterized by a progressive impairment of memory and intellectual function that is severe enough to interfere with social and work skills. That's all. Memory, orientation, abstraction, ability to learn, visual, spatial perception, and higher executive functions like planning, organizing, and sequencing may also be impaired. Now, seizures, these can take severe different forms, appearing as disorientation, repetitive movements, loss of consciousness, or convergence. Now, third one is aphasia. Aphasias are a group of disorders characterized by disturbances in speaking and understanding the language. Respective aphasia causes impaired comprehension. Expressive aphasia is reflected odd choices of words, the use of partial phrases, disjointed clauses, and incomplete sentences. Now we must come to spine degeneration, the another point. Degenerative spine conditions involves gradual loss of normal structure and function of the spine with a period of time. They are usually caused by aging. Aging is the primary factor, but may also be resulted by tumors, infections, or a condition, arthritis. Arthritis destroys the margins of the vertebrae. Pressure on the spinal cord and nerve roots caused by degeneration can be caused by slipped or herniated disc also. Now, symptoms due to degenerative spine disease: there is spinal deformity, loss of curvature, loss of lordosis, kyphosis, scoliosis, limited motion due to facet arthropathy. There is limited motion, pain may be sharp or chronic, pain may be due to movement or better with rest, or sometimes it may be due to during rest. Nerve injuries may be there, weakness will be there, sensory loss will be there, paresthesias will be there, bladder and bowel dysfunction problem, irritable bowel syndrome like symptom may be there. This will be called as pseudo irritable bowel syndrome, and sexual dysfunction will be there. It may also include, I've already told, spinal curvatures, kyphosis, lordosis, and scoliosis. There is intervertebral disc disease, IVD, disc degeneration, disc protrusion, herniation, or bulging. There may be spondylosis, there may be spondylitis, there may be spinal stenosis, there may be spondylolisthesis, and there may be diffuse idiopathic skeletal hyperostosis. Spine curvatures, kyphosis, lordosis, and scoliosis. These are types of spine curvature. Kyphosis generally refers to a convex curvature of the spine in the sagittal plane. A diagnosis typically refers to excessive kyphosis of the upper thoracic spine. Scoliosis is curvature of the thorax or lumbar spine in the coronal plane. Whether toward the left, this is levoscoliosis, and toward the right, that is dextroscoliosis. A lordosis typically refers to excessive concave curvature of the lumbar spine in the sagittal plane. The patient bends forward. In IVD, intervertebral disc disease, it may include pathologies like disc bulges, disc herniations, osteophyte formations, loss of disc height, and disc desiccation. Osteophytes or bone spurs often protrude from the edges of the vertebral end plates and sometimes bridge the intervertebral disc spaces. Osteophytes develop in response to alteration of the localized pressure and may restrict the movement also. Another point is disc degeneration. It is age-related condition normally that happens when one or more discs between the vertebrae of the spinal column deteriorate and break down, and they lead to pain. In case of disc protrusion or herniation, disc protrusion is bulging of the intervertebral disc dorsally as well as dorsally as a result of tearing of the inner fibers of the annulus fibrosus and dorsal displacement of the nucleus pulposus within the disc. The nucleus pulposus comes out and protrudes, and that indents the nerve or thickens. Spondylosis refers to the inflammation of the joints of the spine, because the inflammation of the joint is known as arthritis. This is arthritis of the spinal cord. Inflammation may result when ligaments, tendons, and joints of the spine are acutely injured. Inflammation of the spine may be associated with systemic inflammatory disease also, like rheumatoid arthritis, ankylosing spondylitis, etc. In case of SLE, we can see also. Spinal stenosis refers to the narrowing of the spinal canal or neural foramina. Stenosis can be congenital, but it is commonly degenerative in origin. It can be congenital in the case of Chiari malformations, Chiari 1, Chiari 2. It may be asymptomatic, but it is often associated with numbness and tingling in the limbs and distal parts. Spondylolisthesis is a condition that occurs when the vertebral body slips with respect to adjacent vertebrae. A vertebrae slips against another one, causing radicular or mechanical symptoms or pain. This is very important point. Whenever there is a mechanical disorder inside the body, the symptoms appearing due to mechanical disorders can be treated with mechanical means also. Simillimum is needed here. Alone medicine is not going to relieve permanently. Diffuse idiopathic skeletal hyperostosis, DISH. It is a disorder characterized by excessive bone formation and continuous ossification of soft tissues along the anterior and lateral aspect of the spine, generally with preservation of the intervertebral disc height and apophyseal joints. There is ossification of the paraspinal areas. Now we must come to internet use. The rapid expansion of the internet has increased with the ease with which the public can obtain any information. To obtain any information, we are not searching on the textbooks. We are just going to search on the mobile with any search engine, and we are getting knowledge very easily. Little is known about the consequences of it in general population, but we have searched some points. We will discuss it. This is electromagnetic spectrum. You can see there is AC power, 50 hertz. We are using the form of electricity. We are using radios, the AM and FM frequencies in television, the radio waves, telephone, mobiles. We are using microwave inside our kitchens. Satellite is there, which is emitting the radiations. Light bulb is emitting the radiations, infrared. Sunlight is there, ultraviolet and mixture of radiation from sunlight. Sunlight has all the ranges of radiations. Medical X-rays are there, CT scan, MRI is there, PET scan, etc. Radioactive sources are there. Some industries, gamma rays are there, X-rays are there, ultrasound, ultraviolet is there, infrared, microwave, radio wave wavelengths. You can see from. You can see here. As the wavelength decreases, the frequency increases and the penetration power of the radiation increases. The higher the frequency, higher the penetration power. This is another one. There is ionizing radiation and non-ionizing radiation. 1 kilohertz to 1 gigahertz. You can see sources smaller to scanning sources, X-ray and gamma rays. We are inside somewhat in mid you can see the UH of ultra high frequency, that is in the mid. After television, mobile is there. We are going toward the higher frequency radiations and waves, electromagnetic waves, which have capacity to penetrate our body. There is constant geomagnetic field on the surface of the planet as solar wind generated from the sun meets with the inside the earth. Therefore, all the life of earth is always living with the presence of electromagnetic field known as EMF. There are many controversies regarding RF EMF exposure, but many of the studies have focused on cancer. You can see the references also. Morgan et al. 2015. Genetic damage, neurological disease, reproductive disorders, immune dysfunction, kidney damage, as well as electromagnetic hypersensitivity and cognitive effects. Different studies are there. I have quoted the sources. Recent studies show that RF EMF emitted by cellular phones are absorbed into the brain to a degree that can affect neuronal activity. This study was done in 2008 and was reproved in 2015 and then in 2016. It may cause genotoxicity, cancer, the blood-brain barrier, affect memory, neuronal activity, and neurotransmitter effects. These are altogether called as biological effects of the central nervous system. Using the internet for health purposes is associated with increased depression. The increase may be due to increased rumination, unnecessary alarm, or over attention to the health problems. Excessive internet usage is especially influential in children and teenagers. We can see our teenagers are using late night mobiles. Teens like to text at late hours, reducing the amount of sleep, and they must have in night. This sleep deprivation can result in cognitive problems such as trouble focusing and memory deficiency. There is another term, Facebook depression, cyberbullying, and other negative effects of social media. Studies have shown that increased Facebook usage is linked to greater feelings of social isolation and lowered life satisfaction for many teens and even adults. When people spend many hours a day looking through our friends' profiles, it can trigger a sense of jealousy and self-dissatisfaction also. There is another condition, computer vision syndrome, strained vision due to excessive use of eyes with computer, laptop, tabs, or mobiles. Due to postural deficit, due to bad posture, there is neck and back pain, prolonged sittings and muscle strains are there. Hearing loss may be there. Blood pressure may rise up. While not all heavy internet users show this symptom, there is potential correlation between high BP and still sitting still for hours on end due to sedentary habit. Headaches, blood vision, dry eyes, and light sensitivity may be experienced from long hours in front of the screen. Now, we must look at the mechanism of hazards caused by internet. Electromagnetic waves emitted by mobile phones are high frequency waves, and they can vibrate the neurons, vibrate the tissues, vibrate the cells, vibrate the fluid inside the cells at a frequency which may cause friction among the particles and may increase the temperature inside the cell, just like microwave in the kitchen. Thus, capable of temperature increase, such heat reactions are expressed quantitatively by a specific absorption rate. A specific absorption rate can be calculated very easily, and you can prove in the labs also. Just use the mobile for a long time, and the temperature inside the brain cells will be increased. Because RF EMFs can penetrate into the body and cause vibration of the charged or polar molecules inside the tissues. It can be critical to human health and safety. It has also been found that exposure to electromagnetic radiation, a type of RMA EMF, increases the incidence of chromosomal aneuploidy. This has been studied in 2003. Genetic toxic effects, including aneuploidy, can lead to genetic disorders with abnormal gene formation and can even lead to cancers. This was studied in 2009. WHO has classified RFEMFs as possibly carcinogenic to the humans in 2011. There is considerable evidence about the exposure of RFEMF that cause various types of genotoxic effects in cells. Different studies are there. Exposure to these RFEMFs causes DNA oxidative damage in the mitochondria. Inside the mitochondria, DNA oxidation is impaired and mutation is there. DNA fragmentation and DNA strands break inside the neurons. Due to breakage of the DNA strands, mutation takes place and Hebger result appear. Neuronal damage in the cortex, hippocampus, and basal ganglia was significantly increased in a rodent model exposed to RFEMF in 2003. The experiment was carried out on the rodents, and their cortex, hippocampus, and basal ganglia were significantly damaged. Neurological cognitive disorders like headache, tremor, dizziness, loss of memory, loss of concentration, loss of sleep, sleep disturbances due to RFEMF can be studied very easily. These can be seen very easily. And these has been reported by several epidemiological studies in 1996, 2006, and 2007. Electromagnetic waves, especially RFEMF emitted by mobile phones, are absorbed into the brain and they increase the heat inside the neurons. This was again studied in 8 and 2015. In addition to the changes in genes, proteins, and proliferation of nerve cell exposed to RFEMF, physiological changes in the cell membranes and ions at cellular levels has been reported by various experiments. Exposure to RFEMF can cause significant structural changes in myelin proteins. In the beginning of the slides, I have shown a table which was used to show the changes in the various proteins which was associated with certain brain lesions and conditions. Changes in the myelin protein can cause myelinogenesis, leading to symptoms of electrohypersensitivity. This was studied in 14 to 17. The autophagosome and autolysosome, which were the major autophagic structure, were increased 3 to 4 times higher than in control group with exposure to electromagnetic field. Autophagy causes damage to the neurons. This is a schematic summary of possible mechanism of RF EMF radio frequency electromagnetic field exposure in the central nervous system. It causes heat, changes of ion channels, demyelination, autophagy, and effect is disorder in the brain. Now, homeopathy in terms of magnetic field. Homeopathy is the science of curing the sick individuals with precisely controlled electromagnetic modulation affecting the entire organism, capable of producing desired effects. While applied on the principle, the weaker dynamic effect is permanently extinguished by the stronger one if the latter is similar to the former in its manifestations, whilst differing in kind. Henneman has already told this condition. Homeopathic modulation and unwanted forces affecting the organism. We can see, we have just studied about the mechanism of neurological degeneration due to induction of various catabolic processes, destruction of nerve tissues, mutation in genetic materials, production of harmful proteins and fats, as well as their deposition in the affected systems and development of various disease pictures. Homeopathic medicines have dynamic effect on all the vital processes running inside the living body. While this effect is applied therapeutically, the deranged vitality comes to be normal. Thus, it is self-explanatory that homeopathy has its direct influence on the morbid forces affecting the health, or homeopathic remedy are the only answer to the sickness caused by the radiations and this type of electromagnetic effects. Now we can compare the electromagnetic chart with our homeopathic preparation. You can see the plane with up arrow and potential is down arrow. And in the electromagnetic spectrum, frequency is increasing upward. Here in the first line, you can see in the target, the plane is increasing, right? In the bottom is there is chemical composition of the body, then next biochemical reaction in the body, then living tissues as a whole, then catalysts like enzymes and hormones, then secretory glands, endocrine, exocrine glands, and peripheral nervous system, then master glands and central nervous system, then hypothalamus and hypophyseal axis, then mental and emotional entities. The plane is being more dynamic when we go upward. And in case of this electromagnetic radiation, the frequency is increasing from down to above in the same pattern. Now, the in chemical composition of the body, whenever the chemical composition of the body is causing illness inside the living organism, we are using low potencies. And in the dynamic plane, when mental disorders are there, we are using the highest possible potencies. This is the similar spectrum which are using in homeopathic practice. In chemical composition of the body, lowest potencies. In biochemical reaction in the body, lower potencies. In living tissues as a whole, medium potency like 30. Whenever catalyst or enzymes and hormones are causing the illness, medium higher potency like 200 must be used. Whenever secretory glands like endocrine glands, exocrine glands, and peripheral nervous system is involved, we must use higher potencies like 1M. Whenever master gland or CNS is involved, we must go for more higher potency like 10M. Whenever hypothalamo-hypophyseal axis is involved, we must use very high potencies like 50M. And whenever mental and emotional entities are there, and physical symptom is never not there, only mental symptoms are there, we tell you we must use very high, ultra high potency. In brain atrophy and spinal degeneration, with effect of radiation, there are certain remedies. Very short repertoire is there. There is a sort of concussion when vibration inside the brain is there is a micro concussion. Whenever we are using mobile phones for a long time, if we are exposed to the radiation for a long time, there is a vibration. In the starting, there is only vibration, and afterwards it will be converted into heat. So we can take the rubric: injuries of the head after arnica natrum, concussion of the brain, arnica, sacuta, virosa, hyperical repertory, oromat, barata, phosphorus, lemon, etc. Degeneration of spinal cord, single remedy is given there: picric acid. Softening of the brain, calcarea, phosphorus, suja, etc. General atrophy, decrease in the number of cells, conium and kali iode. General radiation therapy from effect from radiation therapy. This is rubric from synthetic repertory. There are several remedies, 44 remedies are there. General weakness after radiotherapy, there are 2 remedies: carcinosin and radium brom. Now, ginkgo metallicum is there. There is grand text, but I have chosen a limited points towards ginkgo metallicum. The relief comes from appearance of discharges or eruptions. This is valuable in various neurons arising from profound disturbances of the nerve centers and brain and spinal cord, especially cerebral exhaustion. There is nervous fidgety movement of the feet, especially in retiring and during sleep. Headaches, they come from drinking even a small quantity of the wine. Stimulants aggravate in general. There is inability to develop or hold out the rash in eruptive diseases. The rashes fail to appear. They cannot expectorate, they cannot menstruate. Is better if can. The discharges are made. Twitching of single remedies all over the body, violent trembling all over, so as to shake the bed, lost the nerve control. Weakness and weariness on the nape of the neck, aggravation with holding the head along in one position, backache burst. This is a picture which can be seen in the a person who is sitting over the mobile or tablet or laptop or the desktop for a long time. There is backache due to sitting, pain in neck due to holding the head in the one position for a long time, defective vitality, brain and nerve power, wanting to comprehend, memorize. Child cries during sleep, rolls head side to side, face alternately pale and red. These are the rare peculiars. Modalities are from bile, aggravation from bile, and better with restoration or development of eruption during menses, restored expectorants, seminal emission, and discharges in general. Jenkum Met has a complete picture of a person who is sitting before the computer or laptop for a very long time, and he is developing this type of spinal symptoms, cerebral symptoms, as well as the physical symptoms. This text given in the traditional materia medica can be converted into modern materia medica, which I am going to design very soon. In modern concept, Jenkum Met can be studied like this: Parkinson disease, multiple sclerosis, Parkinson plus syndrome, alcoholism, anemia, and spondylitis. These points are given in Jenkum Met. If we memorize these points, we can picturize complete Jenkum Met along with some rare, peculiar, and characteristic symptoms. What investigations are required and what is the indication, this can be studied. Another remedy is Califos. Same picture is there. Loss of emphasis on morality and what is right and what is wrong, you cannot understand. Nervous exhaustion, neurasthenia, loss of self-control, mental and physical prostration caused by a combination of overworking or psychological factor like excitement, worry, and vexation. Slightest liver seems to have look like heavy task. He's very nervous. Starts at slightest sound, indisposition to meet people, shyness, excessive blushing. There are certain very common symptoms you all know. The desire for solitude, fear of open spaces is there. There is deprived feeling, aversion to own family, harsh and cruel to husband and children, due to loss of self-control, irritable from weakness, falls into passion and acts hardly can hardly articulate. Headache simulated by gentle motion, drooping of left eyelid is there. He cannot keep the feet still, like Jenkum Met. So this picture is also just like Jenkum Met, and there is weakness and peculiar pain centering the 7th cervical vertebra, which here and involving the whole dorsal area of the spine. Suspected malignant tumors after removal of cancer, when the healing process is there. This is the picture of Califos, which is simulating the person with radiation. Here, Califos has cervical spondylitis, he has anxiety neurosis, and he has depressive psychosis. Whenever a patient comes with cervical spondylitis as well as anxiety and depressive psychosis, he is a patient of Califos. We have not to learn such a long text. I am not going to narrate all the symptoms. Phosphorus, you all know, we are very familiar. This is also there. Complete picture of a person of this type of sedentary habit exposed to radiations. He may have pulmonary tuberculosis, he may have rheumatism, he may have bronchitis, pleurisy, pneumonia, jaundice, acid peptic disease, he may have neoplasm, like he may have cancerous cachexia, there is thrombocytopenia causing the bleeding disorders, there is gastroenteritis, he has osteoporosis, he has rickets, he has steatohepatitis, the fatty degeneration of the liver. These all the symptoms are due to radiation also. Another remedy is cicuta virosa, convulsions, consciousness loss of opisthotonos, and these are, and he is cheerful in bed. He has cheerful jumping out of the bed. Child is very playful, plays with toys. So the remedy can be summarized here, like seizure disorder and meningitis. Another one is natrum sulph. Natrum sulph has gout, liver cirrhosis, chronic liver disease, gonorrhea, gastroenteritis, bronchial asthma, epilepsy, meningitis, and spinal meningitis. In spinal conditions, there are certain remedies like picric acid, natrum sulph, phosphorus, Jenkum metallicum, Califos, hypericum, and acid phosphoricum also. Thank you very much. This is that. These were the points to discuss. Thank you, KHA. Thank you, Dr. Kavita, for giving me this opportunity. Thank you.
Thank you so much, Dr. Rajenesh, for this valuable information, very detailed. And so is it okay if we take questions at the end of the webinar? Shall we have Dr.
Sure.
Kavita Chandak, please?
Sure.
Is that okay? Dr. Sweta? Please, you can mention in the chat, like we will take questions at the end, please.
Sure, ma'am.
Dr. Chandak, please.
Yeah.
Can you start, please? We
Yeah,
welcome you.
sure. Yeah. Thank you, Kavita, and thank you, KHA team, and thanks for giving me this opportunity to share a very wonderful case on this platform. I guess everybody would love how to select remedies in homeopathy in such multi-layered complex case. So I'm just sharing my screen and we'll start. So am I audible, friends? Kavita?
Yes, you're audible.
Okay. Let me say something. Okay, good. So thank you, my friends. Let us start it. In July 2021, a young man aged 37 consulted me with the diagnosis of diffuse cerebral atrophy. His MRI brain screening showed mild prominence cerebral cholia, suggestive of diffuse cerebral atrophy and degeneration. Just see this report, which he performed on 27th April 2019, and he met me in 2021 July. This report is talking about the same report which I just mentioned you. He said 8 years back, doctors diagnosed me having degenerative changes in L5S1 and 2 years back with cerebral atrophy. I have difficulty in walking like imbalance and backache. My speech is not clear. I fumble. I have thyroidism since 3 years. Nowadays, I feel irritability, and since 2 years, I pass stool but having unsatisfied feeling, that is constipated. I have sensitive throat to sour or cold food since my higher school days. My father had same degenerative changes in his back. He was operated for that, and my mother had asthma. I am sitting for long time in my office using laptop and Wi-Fi. See, lifestyle, we should know the patient's lifestyle before diagnosing our remedy. I am an introvert person. I keep everything inside me. By profession, I'm chartered accountant. Please help me in solving my issues. I asked him to add some more symptoms if he has any. He said, in my old job, we did not have toilet in our office. I had to hold urine for a long time. It was 1 year back. Now I switched my job. I asked him whether he switched the job for this reason only or he had some other problems. He said the working hours were too long and it was annoying to sit with computer for such long time. I was fed up with the monotonous routine, hence I changed the company. Now I have flexible working hours, toilet facility and less stress. The job is same, still working on computer. I feel heaviness in eyelids and head. There is drowsy feeling while talking. My vision is blurred. I feel exhausted and my stamina is not good. Now, my dear friends, our whenever I give my presentation is always interactive. So I'm inviting you all to open to put up your opinion regarding analysis and evaluation of this case. You can type in the chat. What did you observe in this case till now? Nothing? Shweta, can you read the chat?
Yes, ma'am.
Yeah.
Dr. Sumita Grover wrote introvert.
Into,
Introvert.
okay, introvert.
Yeah.
That is only one word is analysis. At least he attempted. I'm happy for that. Thank you, Dr. Sumita.
Holding urine.
I am
Anybody else?
asking about analysis, my dear friends, not asking about the symptoms, which I already explained you. Okay. We don't have that much time, so let us go. The analysis, you see, during interview, I observed that degeneration is the keynote of this case, running right from spine to liver and brain. All other symptoms like heaviness in eyes and head, blur vision, difficult speech, imbalancing while walking, etc., are the secondary manifestation of this degenerative changes.
Sorry to
So
interrupt, ma'am. Your screen was not visible. The
maybe my
previous.
network is not working well, Shweta. But
Okay,
is
ma'am.
it visible now?
Yeah, now the screen
Okay.
is visible.
Now just meet the patient.
को डायग्नोस हुआ कि L5S1 में डिजेनरेशन है, थोड़ा गैप है।
तो अभी कितना ड्यूरेशन गया होगा भैया बीच में इसके?
मैडम 7th ईयर हुआ होगा। आज से आप काउंट करते तो 8 साल और ये 2 साल पहले ये अपना सिलेब्रल ये 2 साल पहले। अभी एट प्रेजेंट मेरे को उनके चलने में डिफिकल्टी होता है और बैक में पेन है, घबराहट होने लगी और चलने में थोड़ा इम्बैलेंसिंग होने लग गया।
जो मैं ऑब्जर्व कर रही स्पीच में भी कहीं तो भी प्रॉब्लम
अभी तो ब्लर हो रही, मतलब कि हो रहा है, फंबल भी हो रहा है।
फंबल हो रहा है, वो समझ में आ रहा है। आपके पूरे बॉडी का एक ही कीनोट है, दैट इज डिजनरेशन। आप पूरा हेड से लेके फीट तक के सिर्फ डिजनरेशन में है।
हाँ।
बैक में डिजनरेशन, ब्रेन में डिजनरेशन। तो मतलब मुझे ऐसा एक और डाउट है भैया, शायद लिवर में या पैनक्रियास में भी डिजनरेशन।
सीटी स्कैन का स्रोत नहीं कराया था
भैया, है प्रॉब्लम गॉल ब्लैडर में है, सूजन है गॉल ब्लैडर में, और ये भी है जो मैं सोच रही थी ना, लिवर का डिजनरेशन इसमें आ गया है। ये 100% बताए नीचे, डिफ्यूज फैटी इनफिल्ट्रेशन ऑफ लिवर, डिजनरेशन से भी एक कदम आगे चला गया है। तो क्यों शुरू है, थायराइड है क्या? ये कब से आया है?
मैडम 3 साल ऊपर, पहले नहीं था ये, मगर अभी बहुत चिड़चिड़ होते हैं पहले से।
रोज पेट साफ होता है?
होता है, मगर पूरा फुल सेटिस्फैक्शन नहीं।
आपको
डैड को भी स्पाइनल का इशू था।
क्या?
लैपटॉप कंप्यूटर यही है थोड़ा यूज करने का।
गुस्सा आता है तो उसको कैसे एक्सप्रेस करते हैं आप?
मैडम शांत रहता हूँ और क्या,
मतलब आप गुस्सा अंदर दबा लेते हैं? आप बोलने वालों में से नहीं है।
So this is all about the case, which I have already explained the case symptoms to you. His MRI cervical spine with spinogram study showed degeneration at L5S1 with annular tear. Additionally, he has acute cholecystitis, diffuse fatty infiltration of liver, and grossly distended gallbladder. You can see in his reports. So from all this scenario, I considered few rubrics here. First rubric I considered was mind reserved, brain atrophy of head heaviness accompanied by eyes heaviness of eyes, lids heavy, mouth speech difficult, abdomen fatty degeneration of liver, back spine complaints of spinal cord, back degeneration spinal cord, and from general degeneration of tissues tendency to and fatty degeneration organs. So I considered all these rubrics here. And many remedies came up like phosphorus, lyco, plumbum, gelsemium, naxomica, auramate, conium, merxol, agaricus, and picric acid came up. But you see, whenever there is degeneration, we usually first think about phosphorus because, and coincidentally in this case, phosphorus came on the first position in my repertory chart. I did not prescribe phosphorus. Why? Because it covers degeneration and fatty infiltration of liver, but It does not cover degeneration of spinal cord as well as degeneration of tissues. It is good for organ degeneration. That's why I rule out phosphorus. Because you see, in such cases, we need to consider every small symptom here. So in this case, I prescribe vanadium made 30, given twice a day for 15 days. Why vanadium? There are two rubrics which covers vanadium. First is fatty degeneration organs, and second, tendency to degeneration of tissues. We have two remedies. First is arsenic and second is vanadium. So in this case, I chose vanadium. There are few more reasons behind it. It is, let me tell you something about vanadium. It is a hard silvery gray colored metal. Initially, it is called as brown lead, later named it as vanadium. It's a heavy metal. Metals are obtained from mineral kingdom. Many wonderful remedies are prepared by potentizing the metal. Metals have direct action on human physiognomy. They affect almost every vital system of the body. Metals are also used as therapeutic agents. It is present at the center part. I'm talking about vanadium. Vanadium present at the center part of the left side of the top rows. It is present in the fourth row, fifth column in periodic table. And this remedy is proved by Dr. Burnett. Sphere of action is circulatory system, mucous membrane. And clinical indication for these remedies are Addison's disease, anemia, liver disorder, malnutrition, fatty infiltration, and emaciation. Theme of metal remedies are first attack, defense, and performance. Now let us talk about something, some mental picture about the vanadium. Vanadium people have to be successful, but they are not allowed or they are not capable. They oblige to live up to many tasks, but they are confused as to what task should be performed first and what task should be performed in the last. They cannot set the priority. They don't really know what they want. They make plans, but they think that I am not able to fulfill the plans. They feel that they have to achieve a lot in their position, but they are not sure what. See, they want so many things, but they are not sure about what they want. There are so many. See, the person is full of desire, but do not know what exactly he wants. They are always doubting themselves and can't make choices. It is an amazing remedy when there is irresolution. Like they always ask about themselves, am I choosing the correct thing? Am I doing the correct thing? Like that. They're not strong enough to make the decision. And if they do make one, they doubt their choice afterwards. So vanadium, though it is a heavy metal, high metal, but having lot of confused state of the mind. And that is also, we always get degeneration in tissues there. Because lot of thinking, lot of stress, lot of hormonal changes, lot of enzyme changes causes the patient ultimately to land into some degenerative or infiltrative changes. Now, there is always a question mark. Am I married? Did I marry a perfect woman? And they are always doubtful about their results, and there is a fear of failure always in their cases. The theme comes up in their dreams too. They dream of missing the train or getting or not getting to the telephone on time, etc. Their continuous doubting attitude is the reason that they don't complete things and they are always late. See, always you will listen from the vanadium patient. I was trying to do this. I was trying to come on the time, but you know, there were so many work is left and everything was so hopscotch. And I tried a lot and finally I reached here. But I am really doubtful the work I finished at home. I don't know how I finished it, whether it was really complete or I have to go back and to do it afterwards also. Like that, they are all the time confused, lack of confidence and lack of decision making capacity is there. Altogether, we call it as a irresolution. Okay. Now next, see, the cause of this situation can usually be found in their upbringing. There is always a very successful and dominant father. They are brought up very strictly with the task of pleasing everybody, particular their own parents. They have to be good, caring, decent, and hardworking children. Somehow it seems like carcinosin. Carcinosin also has same childhood, but in few matter carcinosin is different. They are highly fastidious and fast. Vanadium is not that much fastidious. They are bothered with lot of discipline. Such a child won't dare to resist their design and eventually won't know anywhere what it wants for itself. He always tries to please everyone and will follow whatever has been told to him. Few characteristic symptoms of vanadium is it is a remedy for degenerative condition of liver and arteries, acts as a tonic of digestive functions in early tuberculosis. Sensation as if heart was compressed, as if blood had no room in the aorta, anxious pressure on whole chest. Fatty heart, brain softening, tuberculosis, cough is dry, irritating and paroxysmal, sometimes with hemorrhage. Anorexia and symptoms of gastrointestinal irritation, irritation of nose, eyes and throat, anemia and arteriosclerosis are there. Why I did not choose arsenic alba? See, whenever you have 2-3 remedies, you should always discuss about differential diagnosis because it is important why you chose the remedy. Till now I explained why I chose the vanadium, but it is again important for you to know why I did not choose the arsenic alba. Because arsenic also covers fatty degeneration of heart and angina pectoris. Pulse more rapid in morning, liver and spleen enlarged and painful ascites and anasarca is there, which was missing in this case. Why I did not go with the phosphorus? Phosphorus is very weak and in phosphorus there is weak and ongoing sensation. Liver is congested, acute hepatitis is there, fatty degeneration of organs are there, heart violent palpitation, anxiety on lying on left side and right side of heart is dilated and feeling of warmth in the heart. So these were few reasons at physical level. For that I decided to go with vanadium, not with arsenic and phosphorus. Now let us see the follow-up. The patient came to visit me after 15 days. And I asked him, it's now 15 days since you are under my medication for cerebral atrophy. How are you now? I took your medicine and feeling 50% improvement, the patient said. Strange for me too, because in 15 days, he felt 50% better. I asked him, can you elaborate? He said, now I can walk, misbalancing reduced, backache is there. I am walking for almost 2.5 kilometers morning and evening. See, now he has started walking twice a day, morning and evening. Were you able to walk same before treatment? I asked. He said no. And then my next question was, how much were you walking before 15 days? He said almost 1 kilometer. Then I asked him, do you have fear of falling now? He said no, balance is good. I feel like twist in leg once in a blue moon. Then I asked about vertigo. He said it is not there. My next question was about drooping of eyelid, ptosis. He said it is better now. Then my next question was that if everything is better, then what are the problems now? He said blurring eyes, burning eyes, dim vision, speech is blurred, humbling is there, backache, acidity. Though I am confident now, though I am feeling better, but the complaints are same, little reduced. But I am energetic than before. I am happy with the effects of your medicine. I am taking only your line of treatment and nothing else. Just see his follow-up after 15 days.
15 दिन पहले मेडिसिन डाली थी सेरेब्रल एट्रोफी पे.
I'll forward you.
अब 2 बार वॉक को जा रहे हैं.
Already explained.
ये भी गिरूंगा.
कुछ नहीं, इम्बैलेंस कुछ नहीं होता है.
एकदम
मतलब
कॉन्फिडेंट हो.
ऐसे सीधा चलता हूँ, कभी कभार थोड़ा सा होता है इम्बैलेंस.
ओके.
तो मैडम
थोड़ा सा हो सकता
होता
है।
है, हाँ।
भैया वर्टिगो का क्या पोजीशन
मैम
है?
अभी वर्टिगो का कोई नहीं है।
लास्ट टाइम ना एक कंप्लेंट आपका था भैया कि आंखें अपने अपने आप आपकी पलकी गिर रही थी, टोसिस।
नहीं मैम, कम हुआ है।
कम हुआ है।
कम हुआ है।
पर अभी आंखों में क्या हो रहा है फिर?
मैडम जलन हो रही काफी।
हाँ।
और बस विजन का थोड़ा सा ये है, और स्पीच ब्लर हो रही है, बैक पेन है।
ओके।
और एसिडिटी हो रही है।
ओके।
मेरा कॉन्फिडेंस बूस्ट होना अंदर से, वो भी अभी बूस्ट हुआ है।
वेरी गुड, वेरी गुड।
तो अभी क्या ना कि पहले से भी थोड़ा ज्यादा एनर्जेटिक भी फील कर रहा हूँ।
वेरी गुड।
अभी
So this was his follow-up after 15 days. Now, again here, I just continue vanadium med 30 given twice a day for 30 days. Same, because improvement was there and I did not want to change the remedy so fast. Follow-up after 45 days. Then I asked him, how are you now? He said, I have a slight difficulty in walking and slight giddiness is there. I asked him, see, it's been 45 days for homeopathic medication, 28 July to 9 September. How much improvement did you observe? He said it is around 60%. You can see his video.
अभी कैसे भी आप?
मैम अभी ठीक है, मगर वही है, ज्यादा चलने में थोड़ा दिक्कत होता है बस।
अच्छा।
और
अब
थोड़ा सा घूमता है।
सर थोड़ा अभी भी आपने को 1.5 महीना हो गया दवाई शुरू करके आपका?
हाँ मैम,
है ना?
1.5 महीना।
Because we started it at 28 July 2021.
Yes, ma'am.
And today is 9 September.
Yes.
So how much improvement you
मैम
observed?
मैम मेरे को अगर इम्प्रूवमेंट अगर मैंने काउंट किया तो 60% के अराउंड है पूरा।
Okay. Thank you. Thank you.
You see, it was strange for me because he has 50% improvement in the first follow-up in just 15 days, and now after 45 days he's saying just 60% improvement. See, vanadium was working well, but something was there which was not letting vanadium to work in its full strength. So this is now you understand that there must be some obstacle in the recovery, because in 15 days 50% improvement, in 45 days 60% improvement. So it is not good for me, and I was thinking that what can be the obstacle for the recovery here. I understood that I must address this obstacle to recovery in this case. And for that, I again discussed and I planned a recase taking with him. Patient said, I feel muscular weakness. There is occasional heaviness in the lids. I feel pain in the upper part of eyebrows. All these symptoms started with my last job where I used to sit for long hours working on computer. I used to read articles on phone for 2-3 hours daily. Now I reduce the reading time, but still using mobile phone to surf social media. Due to COVID lockdown, I started playing games on tab and phone. I changed the job now, but my work is same. You see, all the time he is with laptop, phone, tablet, Wi-Fi, and that's all. Hanuman mentioned about exciting and maintaining causes in aphorism 7. He wrote, we need to remove these obstacles to recovery to achieve the cure. For his muscular pain and headache, in this case, the first remedy came into my mind, it was gelsemium. But I cannot prescribe only on 1 or 2 symptoms. But what about the excessive exposure to electromagnetic radiation? It is also responsible for headache and eye symptoms. Dr. Sharma has already explained it very well, the symptoms and the effect of electromagnetic frequencies in his presentation. So I'm not going to explain it thoroughly right now. He was constantly under Wi-Fi since years at his working place and at home. Although there is very less established scientific evidence of adverse health effects from the Wi-Fi exposure, RF exposure, but a homeopath knows how our energetic field get diseased. Even a small thing, small toxin, even can enter in our energetic field, in our vital force, and we get that imprint of those toxins which causes disorders in our body. Toxic substances can leave an energetic imprint that lasts for the year even after the removal of the toxin. So here in this case, I actually wanted to find out a remedy or to put such a remedy which should work to help me in removing the obstacle, or you can say in removing the exciting and maintaining cause in this case. You see, in Hahnemann's era, there were no pollution, no hygiene, no radiation, and no stressful lifestyle. But today's modern era gave us a lot of comforts with a package of lot of diseases. With every modern high-tech device, we get hidden adverse effects. A study performed in 2018 talks about Wi-Fi is an important threat to human health. Because repeated Wi-Fi study shows that Wi-Fi causes oxidative stress, cellular DNA changes, endocrine changes, and calcium overload. And there is a study which is performed in July 2020. It talks about oxidative stress, that how oxidative stress as a result of the imbalance between oxidative and antioxidative processes in the cell, therefore plays an essential role in the pathogenesis of numerous chronic degenerative disorders. So in short, we can say that oxidative stress is somewhere responsible for chronic degenerative disorder process happen in our body. Here, either EMF radiation remedy, that is electromagnetic radiation remedy, which counteracts the ill effects of the radiation, was my first choice, because the patient was getting all the time ill effects from computer, tablet, phone, etc., etc. Or Wi-Fi radiation remedy was my real need in this case. I prescribed Wi-Fi radiation 10 m 1 aqua dose. These remedies are not proved traditionally. By simply reading the well-documented effects and adverse reactions of the drug in question, we have a comprehensive set of symptoms for each medication. Effects have been well studied and the medications have been used by humans on a large scale. You see, we call it as a, nowadays we call it as a pharmaceutical materia medica, or we can say it as a synthetic materia medica. So I use this remedy and follow up after 60 days. He came to visit me after 2 months directly. I asked him, how is your speech now? He said, previously there was fumbling in just 5 minutes, which was embarrassing. Now I can talk fluently for 10-15 minutes without fumbling. And patient told me that you must be observing, see how I am talking to you. I said, so now do you trust homeopathy? He said, yes, 110%. Then I asked him about the vertigo. He said it is better. Now I am confident and doing all work. Then my next line was, we will perform your brain MRI after a few months, as anatomical changes cannot be expected soon. I am observing good functional changes in you. He said, it is because of you, ma'am. Thank you so much. I said, don't say thanks to me just now. Wait. But if you want to say thanks, just thank homeopathy.
ये आज 23 सितंबर है, अभी स्पीच कितना इम्प्रूव हुआ?
मैम पहले तो मेरा 5 मिनट में ही स्पीच फंबल होने लगता था, मतलब मैं किसी से बोलता था तो मेरे को खुद को अच्छा नहीं लगता था, बट अभी मेरा 10-15 मिनट तक की कोई फंबल नहीं होता।
वेरी गुड,
स्मूथली बात करता हूँ,
बहुत ही बढ़िया। और
आपको भी समझ रहा हूँ कि
हाँ, यस। सो अभी होम्योपैथी में ट्रस्ट है
मैडम? 110%।
अच्छा, और भैया चक्कर अभी कैसे आपके? मैम
अभी इम्प्रूवमेंट है, मतलब कि पहले जो मैं वॉक करता था उसमें मेरे को कॉन्फिडेंस नहीं था, अभी अच्छा कॉन्फिडेंस है, मैं खुद ही
भी आगे भी ना दिखा पाए, लेकिन एटलीस्ट फंक्शनल चेंजेस आपके बॉडी में आने शुरू हो गए, तो अपना लाइफ तो रूटीन होना शुरू हो गया।
स्पेशली थैंक्स टू यू मैम,
थैंक
आपके
यू,
कारण ही हुआ है।
थैंक यू सो मच भैया, थैंक्स टू होम्योपैथी।
Now, what should be my prescription at this stage? Please put your opinion. Yes, Dr. Raniman wrote wait. Very good answer. Anybody else? Wi-Fi radiation 10 m 1 aqua dose I gave. As things are better, I thought to continue the same remedy just to speed up the recovery. Now see the follow-up in November 2021.
मैम ये जो मेडिसिन चालू था इसमें मेरा थ्रोट का मतलब मेरा स्पीच क्लियर नहीं आता था। अभी आपको इस दिख रहा होगा कि मैं एकदम फ्लुएंटली अच्छे से बात कर रहा हूँ। मतलब ये बहुत शॉर्ट हो गया, अब तो 70% क्लियर हो गया ये।
वेरी गुड।
और जहाँ तक कि मेरे को लगता है मैम कि जो आपने मेडिसिन शुरू की इससे ब्रेन वगैरह का जो भी मेरा इशू था वो भी सॉर्ट हो रहा है। अभी इससे मेरे को बैक पेन का इशू लगता है।
So right now his main concern was his backache, and which definitely we need to cover now. He was fine but worried about his backache. Speech balancing and vision are already settled. Hence, I decided to put the remedy on the tendency of degeneration. With Wi-Fi radiation remedy, I tried to detoxify the side effect, the adverse effect of the Wi-Fi from his immunity. Now my need was a remedy which can arrest the tendency of degeneration. Sometimes we start with the correct remedy, appropriate medicine, but if you put quality seeds in dirty soil, it won't turn up in a healthy plant. Hence, I again put vanadium mate here. In this case, this time in 200 CH 1 dose every 15 days for 2 months. Because I was very much firm about my remedy, first remedy vanadium, but I just wanted to remove some cobwebs from the immunity of the patient. That's why I used Wi-Fi radiation 10 m potency. Now follow up in February. It is in this year, February 2021. And you can see here what the MRI study is showing. Still there is diffuse cerebral atrophy because we cannot change atrophy anatomically. It is an irreversible structural change. But if you see the same report here, no change. But there is one change. In past report, there is one more word, degeneration. And in this report, performed in February 2022, there is no degeneration. This is what the keynote of the patient, and we put all the medicines on the degeneration keynote only. So I was successful to removing the degeneration word. There is not so difference in atrophy and degeneration, but still they have different two definitions. Atrophy reduces the size of the cell under consideration while conversing its form. Degeneration either eliminates the cell completely or so alerts its form that its specific differentiation is no longer recognizable. And homeopathy medicine was really successful and helpful in this case to stop this specific degeneration, to maintain the specific degeneration of his cell. Then I asked him, your today's report is showing atrophy in brain. It is an irreversible change. With homeopathic medicine, I tried to improve the leg function. How do you feel now? He said, whatever report is showing doesn't matter for me. I personally feel that I am improved. My sufferings before coming to your clinic are reduced a lot. Then I asked him that we first met at 20 July 2021 and today is 24th February 2022. So it is almost 6 months. How much is your recovery? He said, in this duration, I feel I'm 60% recovered, much improvement. See, sometimes patient cannot actually diagnose that percentage-wise recovery, and it is a spontaneous question for them. So whatever they feel, they just answer. But we can see the changes in the lab investigation and the ultrasound and MRI reports.
भैया आज का आपका जो रिपोर्ट देखा है ना ब्रेन का अपन ने, इसमें सेरेब्रल एट्रोफी तो बता ही रहा, क्योंकि एट्रोफी इज इरिवर्सिबल चेंज, तो उसको हम बदल नहीं सकते, लेकिन फंक्शनली ब्रेन का अपन ने इम्प्रूवमेंट किया है होम्योपैथी मेडिसिन ने। लेकिन उसके अलावा आपका फंक्शनिंग कैसे बदला?
मैम देखिए, अभी ये तो रिपोर्ट एक जो बोल रही है वो अलग बात है, बट मेरे को पर्सनली ऐसा फील होता है कि मैं अभी पहले से ज्यादा अच्छा फील कर रहा हूँ। मेरे को बहुत सी तकलीफ जो पहले थी बिफोर कमिंग टू योर क्लिनिक, मेरे को जो तकलीफ थी अभी बहुत कम हो रही है ऐसा लगता है।
भैया हम जब मिले हैं 28 जुलाई 2021 को और अभी ऑलमोस्ट 24 फरवरी 2022 चल रहा, तो इट इज ऑलमोस्ट 6 मंथ्स। तो ये 6 मंथ में हाउ मच रिकवरी यू गॉट विद अवर मेडिसिन?
ये ड्यूरेशन मेरे को 60% का रिकवरी हो चुका है, ऐसा मेरे को पर्सनली लगता है। और काफी इम्प्रूवमेंट है मेरे में पहले से।
ओके, चलो थैंक यू सो मच, आपने
मैडम,
ट्रस्ट
आपको
किया,
भी बहुत बहुत
थैंक यू।
Why I am showing these videos to you? Because I already explained these symptoms to you. Because you can observe the happiness and the confidence on the patient's face. That is our real achievement. So here you will see the report performed in this year, 24th March 2022. I suggested him to go for MRI cervical spine with spinogram, and he performed it. This is the old report and this is the new report. And in this new report, there is no degenerative word is used. If you see here spinogram in the last part, the degenerative L5S1 disc, here there is no degenerative word, as well there is no annular tear word in this report. So his annular tear also got cleared with homeopathic medicine, as well as his tendency of degeneration. Homeopathy successfully stopped it, because you see we cannot recover the atrophy of the brain, but we can at least help the patient from by stopping the further degeneration in the body, because his liver is in degeneration, his eyes are in degeneration, his tissues are in degeneration, he has thyroid, again degenerative changes in the body, his liver has degenerative changes, and now his brain also have degenerative changes. His spine and back already suffered from degenerative changes. So if you won't stop this degeneration, then what else you expect from this case? My acceptance or my cup of tea in this case was only just to stop degeneration and to help the patient for improving his life quality, so that he can live his life without pain, without fumbling, and without the fear of being imbalanced while walking. There are few remedies I want to share with you. Like when people love to watch screen so many times, like nowadays everybody is just spending much time with this screen. I don't know what all these housewives do with WhatsApp or Facebook for hours, but you see, not only housewife, everybody is spending a lot of time, especially our children. So we have few rubrics for that in our repertory. That is love for computer, playing desire to Nintendo, and playing desire to Scrabble. And the topmost remedy for this is Silicea buffo. And my personal experience say that you should put Syphilinum tenuum in such cases. It really helps. Now let me share the strategy to deal with the neurological cases. It's very simple. Pay attention to the keynote symptom. When patient has multiple diagnoses, you see, usually what happens, various homeopaths contacts me worldwide, and they send their cases for case monitoring to me, and they get scattered when patient talk about that I have this, I have that, and there is a long anamnesis of the patient. Don't worry, doesn't matter how much complaints patient have. The matter is only thing that what is the keynote of this case. Just try to put your concentration, pay the attention to the keynote symptom. Second point is remove maintaining or exciting cause of the case. Like in this case, Wi-Fi radiation was the exciting cause. It doesn't mean that I strictly warn him that yes, from today you won't work with Wi-Fi. No, he has to work. It is a part of his profession. But at least in the night or when he actually do not need Wi-Fi, he can switch off it. You all should switch off Wi-Fi in the home in the night when you are not using it. The third point is suggest physiotherapy or massage if really needed, because patient is in the pain. So our medicine works, but it takes little time. But for instant relief, physiotherapy is the better option. So suggest the patient. Then go back to the originally selected remedy after removal of obstacle to recovery. Because your original remedy is the only weapon which is going to work in this case. Though you are using intercurrent remedies, though are using supporting remedy, though are using detoxifying remedy, but your original remedy is your weapon in this case. So you can go back to your original remedy for better improvement. So this is all about our today's session. Thank you so much for your patience listening. I tried to finish in the given time frame. Thank you so much, KHA and Dr. Kavita, for this platform. Thank you, everyone.
Thank you so much, Dr. Kavita. Chandak, it was wonderful, and we will open for questions, please. Dr. Sweta?
Any questions from the participants? Please write it down in the chat box.
I'm reading the chat. I think there is no question.
Yeah, there's no question.
Did they not like the session?
We enjoyed too much.
I don't think so. Yeah, it was very.
Why there are no questions?
Let me ask then until someone asks. So I have used mobile RAD like from T-Mobile or thing, and it worked to some extent. So today, Wi-Fi radiation remedy is one thing which I learned, Kavita. So that is one which I will be using.
Thank you so much, Kavita. And anybody else, Shweta?
No, ma'am, not yet.
Okay. Yes, Poonam, you are correct. Vanadium improves oxygen in COVID times also. And you know, we usually use vanadium for anemia when patient does not respond to ferrum group. So in such cases, use bone marrow remedy along with vanadium. It definitely works.
Waiting for the questions from the participants. Anyone? Please write that in the chat box. I think that is very much clear. Yeah.
Okay.
Okay, there's one question, ma'am, from Dr. Rekha. What investigation should be needed in such cases?
Already explained in the presentation, my dear friend.
Yeah. Dr. Ashok Madan wants to ask, ma'am. Please allow him.
Sure. Yeah.
You can talk.
Hello, Dr. Kavita.
Hello. There are two Kavitas.
Good evening to you. This is Ashok here. Our just simple question to ask, as vanadium was used also during COVID for the oxygen at that time, it worked. But this vanadium 30, the fantastic case that you have shown, that this vanadium 30 was repeated for 30 days, giving daily one dose, or it was a single dose? It was not clear to me.
I think you entered late, Dr. Ashok, because I explained in my presentation that I suggested this remedy twice a day.
Twice a day.
Yeah.
Okay. So twice a day for 30 days.
Yes. Because it is low potency and we can repeat it if it is hurting.
That's fine. Thank you very much for clearing, because repeating 30 or whatever that every day for 30 days was little bit for me. I don't know how to say, but I was wanting to make sure.
You see, there are different opinions regarding the potency. Everybody has some fixed opinions, but be flexible. And if really we are getting good results from anything, then we should be open to use all the potencies in all the forms.
Yeah, certainly. Always fantastic your cases. Really appreciate and thank you very much. Thank you. And thank you to certainly Dr. Shweta or Prince Doctor organizing this and joy. Thank you again. Good evening.
Good evening.
There are some questions, ma'am, in the chat. For back pain is for back pain, is there a follow-up?
My dear friend, everything was explained in this case presentation. I explained that patient said I am improved, and back pain was his concern 2 months before the last follow-up, which I showed you after of MRI.
The next question is from Dr. Sumita Grover. Any specific remedies for side effects of radiotherapy, ma'am?
There are two remedies, Sumita. One is radium brome and second is X-ray.
The other question from Dr. Rekha Sharma is why not we go for no sods as an intercurrent remedy?
Who told you that all the time only nosodes are as intercurrent remedy? See, in homeopathy, Hahnemann mentioned in the sixth aphorism of Organon that you should be unbiased, you should be unprejudiced. If you are prejudiced that nosodes will be intercurrent remedy for every case, then you won't get success in every case. You will get success only in those cases where really nosode were required, and you will fail in those cases where nosodes are not required. So it is not always an intercurrent remedy, but you can use also some other acute remedies. And in this case, I put this remedy not as an intercurrent, but to remove the obstacle to the recovery. So the meaning of intercurrent means the remedy which you put between two doses of your constitutional remedy. That is intercurrent.
Thank you, ma'am.
We will take one more. Yeah.
Yes,
Yes,
ma'am.
Dr. Sweta, we'll take one more question because it is getting late and we are running after time. So in one more question, please.
Sure. This is a question from Dr. Rani Man. How long did you continue but vanadium 200 every 15 days?
I mentioned that I prescribed her vanadium 200 every 15 days for 2 months. It means it was given 4 times.
Okay. This is all, ma'am. Thank you so much.
Okay. Thank you. Thank you, Kavita.
Thank you so much, Dr. Kavita Chandak. And any more questions we are coming up, please feel free to email us at caststudygroup@gmail.com and we will convey to both Dr. Chandak and Dr. Rajenesh Kumar and we'll get the answers. Okay. And it was very nice session, very informative and detailed, Dr. Rajenesh Kumar Sharma's and Dr. Chandak's. So it's a great learning and we would like to take privilege to honor both of your gracious presence and for your precious time in sharing your knowledge as well as wisdom at our study group with our caste certificates. Please kindly accept. Dr. Sweta, please.
Oh, beautiful.
Thank you so much.
Thank you. Beautiful.
And we have shared both, right, Dr. Sweta? Yes. And with your permission, we will announce the upcoming event. Is that okay? On November 6th at 8:30 p.m. India and 10 a.m. Eastern, we have pain management with homeopathy with Dr. Hiralal Agarwal and Dr. Nupur Shah. And many more renowned homeopaths are lined up for CA webinars. And today, we have many CA volunteers, Dr. Poonam, Dr. Sweta Verma, and Dr. Mohammed, and many more. Thank you so much once again to our study group team for the continuous selfless support in doing all our activities. And Dr. Sweta, would you like to say anything, please?
Thank you, ma'am. Thanks to both the speakers. It was an excellent webinar and it is always a pleasure and privilege to hear from both of you. So thank you for joining us at Ka Homeopathy Study Group platform. And thanks to all the viewers for joining us today. And if you want any recording of the previous webinars or today's webinar, you can follow our YouTube channel with the name Kavita Kukunur. You can follow our social media platforms on Facebook, LinkedIn, Twitter, Instagram with the name Ka Homeopathy Study Group. And for any query, you can reach us at kastudygroup@gmail.com. Thank you so much. And don't forget to fill the jot form to receive your participation certificate. Thank you.
Shweta, there is a question in chat. Magdalene asked this question. I would like to answer this one.
Okay, ma'am. Let me just.
I think the question
It
is
is about
could
the
it be...
diabetes.
Yes. Can you read it?
Yes,
Okay.
ma'am. It is from Dr. Magdalena. Could it be any connection between diabetes 3 as in degenerative disease and vanadium from allopathic medicine used in this case as inspiration for homeopathy?
Magdalene, I would like to tell you that for my any prescription, my inspiration is just my patient and nothing else. Thank you.
Thank you so much, ma'am.
Thank you. Bye. Good night.
Good night.
Good night. And are we all set, Dr. Rajenesh and Dr. Kavita? Anything else, or we are good?
We are good.
Excellent.
Yeah. Bye.
Thank you so much. Thank you
you.
to all the participants. And
Thank
Dr.
you.
Sweta will end the session.
Sure.
Thank you. Congratulations.
Thank you. Thank you. Thank you all.